All right, so it is 12:05. So welcome to UC Center Sacramento. We are so pleased to have you here as part of our Wednesday speaker series. And so my name is Cindy Simmons, and I'm the Associate Director for UC Center Sacramento. And before I introduce our speaker for today, I just want to let our audience know that we will be doing Q&A at the end of our talk at 12:45 p.m. You can ask a question after Dr. Whitebook's talk by raising your virtual hand, which should be located at the bottom of your screen. Now it is my pleasure to introduce our speaker for today. So Dr. Marcy Whitebook earned her master's degree in early childhood education from UC Berkeley and a PhD in developmental studies from the UCLA Graduate School of Education. She is the founding director of the Center for the Study of Child Care Employment, or CSCCE, at UC Berkeley. CSCCE is focused on achieving comprehensive public investments that enable the early childhood workforce to deliver high quality care and education for all children. The center provides research and expert analysis on topics that include teacher compensation, early childhood teacher preparation, work environments, and early childhood workforce data sources and systems. Dr. Whitebook began her professional life as an infant, toddler, and preschool teacher. Early in her career, she and a handful of other teachers set out to improve early care and education services by securing rights, raises, and respect for the early childhood workforce. Dr. Whitebook founded the Washington-based Center for the Child Care Workforce in 1977 based on this work before becoming founding director of CSCCE at UC Berkeley. Please join me in welcoming Dr. Marcy Whitebook, who will talk today on California child care on the brink in the face of COVID-19. Thank you.
Good afternoon, everybody. I'm looking at my slides, and I know there are a lot of you out there, but I'm very, very pleased to have the opportunity, and thank you to everyone at UC Sacramento for making this happen and for helping me through the various technological and other aspects of today. When Sandra invited me to speak in April, my colleagues and I at the center, which is part of the Institute for Labor Research and Education at UC Berkeley, had been tracking state policies related to opening and closing of childcare centers across the country. And we'd also been speaking with early childhood teachers and providers about their concerns about working or closing during COVID. And we were in the midst of conducting our first impact survey in California amongst licensed family childcare homes and licensed centers to see what was happening. In late June, we conducted a follow-up survey with many of the phase 1 participants. And of course, we could not have anticipated, but as it happened, that we released the study this morning. So when we set the date for this webinar, I knew we would maybe have some preliminary data from our follow-up study, but in fact, I can share a lot of it with you today. And in the Zoom link, I think, or on the page that you get, you will actually find the study that was released today. It was posted this morning. So let me just say about childcare in California and really across the country right now, the outlook is grim. In April, we saw that childcare was on the brink of financial collapse. And the state's reopening process has further disrupted childcare that, as many of you know, was already tinkering on the edge before COVID. So I will focus mostly on our results from both phases of the survey today, but I wanted to take a moment and talk a little bit about context and highlight the similarities and discrepancies in California about how we're approaching or have approached the opening of childcare and schooling and the safety and well-being of teachers in K-12 and early childhood. And then I'll just talk a little bit about the childcare system pre-COVID. So it'll be a sort of a platform on which to put these findings. Sensitive. Okay, there we go. So talk of school obviously is filling the airways, the Zoom chats, and family conversations across the state and the nation. Fall's approaching, parents are struggling to manage their work and care responsibilities, and worries about children's learning and well-being after several months of COVID are mounting. It seemed that a return to school or some level of in-person schooling was on the horizon, but the surge in cases and the evolving science about children, their risk and transmission have further complicated finding out how to balance the many conflicting needs and demands regarding learning, parents working, and our economy, and child, adult, and community health and safety. K through 12 teachers, in my opinion, as they should, are voicing their concerns about health and safety for children and families in the community, and also about their own health and that of their families. One teacher put it in a New York Times editorial on Sunday, put it rather starkly when she said she was willing and prepared to take a bullet to save a child in the age of school shootings, but she was asking her to return to the classroom amid a pandemic and expose myself and my family to COVID is like asking me to take the bullet home to my family. So she speaks for many teachers who just aren't willing to risk their own health and that with their families by exposing them to COVID without proper safety precautions in place. And although, we know many teachers are struggling on multiple levels with childcare, trying to figure out how to do their jobs remotely, and whatever economic impacts COVID has had on their own families, their own salaries and benefits, by and large, have remained intact. And they have been, on balance, up until now, able to protect their health as they work from home over the last few months. Due to the large surge in cases and the evolving information about children at risk, Governor Newsom, as I'm sure you all are aware, on Friday, put opening schools for face-to-face learning on pause, laying out guidelines that needed about when it would be safe for communities based on community spread to open or close and reopen, and also trying to sort out requirements for testing of teachers, ventilation and other changes to facilities, and making sure all these things were in place before opening. Now take a moment to consider the social, or what I would call the societal distance, if you will, between what is happening in California's childcare programs. When state and federal contracted programs, and I think since largely people on this call are familiar with childcare, so think pre-K and Head Start, did close, and teachers for those, and for salaries for teachers and staff in those programs have been covered. Most childcare programs were not directed to close and did not receive specific support. Some may have had continued subsidies, payments from families, but the vast majority of programs in our state and around the country do not get any public funding. There were some regulation guidelines, some regulations were modified, and there was lots of guidance both from CDC and from the state about social distancing and health and safety practices for programs that were continuing to operate. And of course, there were a number of programs that were selected to provide services for essential workers, and the costs for those families were covered. But most programs were just left to decide what to do on their own. They were given what I would call kind of a flashing yellow light, kind of up to you to decide what to do. And then in May, when we moved into opening up, childcare was essentially given a green light to open up, but with new public health regulations around group size and some procedures for safety procedures. As of Monday, 8,433 center-based programs in the state, which is about 2/3, were open, and 24,915 licensed family childcare programs were open. And as of Monday, there had been 1,248 cases of COVID reported statewide in child care centers and homes. Unclear exactly what proportion of all programs reported. And many of those cases were most of those cases were among adults, as we would expect from other information we know about children's positive cases in children.
Dr. Whitebook, the slides don't seem to be advancing. Oh, perfect.
Oh, no, they are.
Oh, great. There we go. Thank you.
Okay. That was the longest moment you'll see it beyond in one slide. So I think that early educators, if you stop to think about them, many of whom are working now or who are not working but with no support, are just as deeply concerned about the health risks of operating during the pandemic as teachers of older children. Like K through 12 teachers, many have their own health issues, and many are older. About about a quarter of center-based early educators, as of data from a number of years ago, the most recent we have, are over 50, and for family child care providers, the number is about 39%. So early educators are in fact terrified about their health, but they're also terrified about their livelihood. And many have continued to work because they have no other options to support themselves and their families. As one provider noted, the pressure is extreme, and people talk about it being nerve-wracking to do the work, given the risks involved. Many people have come to understand that early child care teachers are essential workers because of COVID. You could argue they've always been essential workers to keep our economy going. But they're not treated that way, and have not been treated that way in this moment of COVID or before the pandemic. The pandemic has prompted an unprecedented crisis in California, but that crisis was not created by COVID. COVID has escalated the crisis that we know was happening beforehand. So let me just give you a little bit of information to put things in context. So our early care and education workers in California are among the lowest workers in the state. 58% of childcare workers in the state access some kind of federal income support. And you can see here that even center directors, who are on average the highest paid members of the early care and education workforce, make far less than kindergarten teachers and not much more than the average worker. And this is despite the fact that a large proportion of early educators in the state have 2- and 4-year degrees. I'm sorry, this keeps jumping around here. All right. Okay. So I think it's important to take a moment to think about who the race and ethnicity of our early childhood workforce in California. Now, these data are from 2012 because we don't have regularly collected data. We're about to get an update from the same study that was very comprehensive, called the National Survey of Early Care and Education. But there's not much reason to think things have changed since then. And what you see here is that the majority of early educators in California in the center-based workforce, less so, but are women of color, and predominantly in the home-based sector of the workforce. And that's in comparison to about 35% of K through 12 teachers being people of color. And so we have these disparities about not just wages, but we also have disparities in race in the early childhood workforce. Early educators are 6 times more likely than K-12 teachers to live in poverty. And for Black early educators, they're more likely to live in poverty than any other early educators. And the disparities the disparities here have a lot to do with wage penalties that exist in early care and education, because the younger the child, even in that 0 to 5 space, the lower the wages are. That nationally, on average, early educators have a wage penalty for working with infants and toddlers compared to preschool teachers. There are also wage penalties depending on where you are in the system. So if you are in California, if you're in a Head Start program, you're going to earn a higher salary than you are in a state preschool, and both the state preschool and Head Start staff earn more than people in other kinds of childcare. Early childhood settings, and that is regardless of people's educational attainment. So whether they have no college, a 2-year degree, or a 4-year degree, there are wage penalties. But over and above that, there are wage penalties for Black and, in California, Latinx early educators. Along with those disparities amongst the workforce, there's disparities in terms of access to childcare and cost of childcare. A lot of what those disparities are based on the fact that childcare is not offered as a public good. It's in the private market, and access to type of program and the cost for that program relative to a family's budget is relative to a family's budget. So really, children have access to what their families can afford, and the families with the least financial resources are paying disproportionately more for childcare. We do have public dollars that go to help families with lower incomes to cover the cost of childcare, but they serve only a fraction of those who are eligible. And that inequity between those who are eligible, those inequities just endure year after year, even though we try to make investments, and policymakers have tried to increase the percentage of children who are covered. We still are not covering anywhere near the number of children who are eligible. And one thing to think about in terms of COVID is how many more families now are, because of loss of income or cutback in hours, are going to struggle even more with childcare costs. We think of the education of children from kindergarten on as a right. And of course, there are disparities that demand our attention in the quality of education children receive in K through 12. But for ECE, despite all the touting of how it's the most important years of, we talk about the brain science, we talk about how early it is, how important it is to children's well-being, to the economy going forward. Children suffer because early childhood is something that their families have to purchase. It's not seen as a right as it is in other countries. And I think often I think policymakers lose sight of the fact that only a small portion of families have access to the public support. And so the public support and the way it's distributed actually tends to reinforce inequities among families and certainly among the workforce. And we see now, again, with the schooling crisis because of COVID and the childcare crisis, that we see that families who have more income are able to consider ways of purchasing some kind of care or schooling for their children. I was just reading this morning about family pods and people paying individual teachers to work with a few children. And obviously that's not an option for many, many families. Okay, so in May, we released results from our phase 1 survey, and we surveyed over 2,000 childcare programs throughout California. These were licensed childcare centers and licensed home-based providers. And as you can see, it was about a third centers that responded and about 2/3 family childcare, which is roughly similar to the population of centers and homes in the state. And you also will see that a far higher percentage of family childcare homes were open compared to centers. Okay. So last week we released a regional snapshot from our phase 1 survey, and you, I think, got the link to that today too. And that, for those of you in different parts of the state, will give you, or who represent different parts of the state, will give you a different, gives a little bit different picture of the percent open and closed. Generally speaking, there are more programs proportionately open in Northern California and fewer in the Bay Area. We will release our phase 2 survey regional data, in the forthcoming weeks. So what we learned was in phase 1 is that programs were facing financial challenges. They had families that couldn't pay or had lost their jobs or income, and they also had low attendance. So that also affected their income. And it really just underscored for us these financial challenges that for an industry that was already operating on very thin margins, with many staff earning such low wages, when families couldn't pay or they lost the number of kids attending, it made them even more precarious. We also learned of widespread staffing changes in phase 1. As you can see here, almost 3/4 of programs have made some kind of staffing changes. That was if they were open or closed. This was in April, so there were still programs that were trying to pay staff, but maybe cutting their hours, or some were having to lay them off. But the majority of programs had done something around with regard to staffing. And we also heard during the phase 1 that people were having a lot of difficulty accessing essential supplies. And as you may recall, if you think back to March and April, it was very, very hard getting cleaning supplies. And some of the things that providers and center directors were telling us is that they were having, by the time they would get to the store, if they were open, there were just no available supplies for them. And of course they were very anxious about that, for both because of the recommendations about how to keep programs, maintain sanitation in programs, and they were also very concerned about the issue of personal protective equipment for staff, which was essentially non-existent. Programs were also just really, whether they were open and closed, they were just very distressed about the guidance they were getting, and they weren't kind of clear if they were supposed to be open or closed, but they also felt like the social distancing guidance were just unrealistic. People were just wondering if people who had written them had actually ever been around young children. There were things like babies should cover their sneezes, and teachers should make sure they change their shirt and children's shirt if a child cried, in case they got some bodily secretions on them. And then there were things, and this was true in California, where there was a suggestion that children, preschool children, be given yarn to sort of mark off their appropriate distance between them. And of course, early childhood is not an environment where you would actually want people to stay apart from each other, and people really just didn't know how to go about and do that. So that's kind of where we left off at the end of phase one, that we knew that there was a need for financial relief. People needed supplies, and people just really wanted greater clarity about safety. In late June, just after we've been opened up a little bit more, and in early July, we conducted a follow-up survey, and 953 of the respondents from the first survey completed the second survey. And here you see a couple of things of interest. You had slightly more centers responding this time than previously, and slightly few home-based providers, but not in a significant difference. But what you do see is that there are more programs open, that you get almost double the number of center-based programs open in this subsample, and somewhat more of family child care programs opened as well. We did note that 39% of centers that have been closed in the phase one survey that responded had reopened. And one other thing I just want to say about this survey is this time we actually tried to, we had a lot more open-ended questions, or just much more detailed questions, sort of drilling down to find out about people's experiences and to capture in their own words, some of the things they were facing. And we just had an overwhelming number of, I think it was over 700 open-ended responses from people in the survey, because they feel they have a lot to say about what's going on. Uh-oh, I just went the wrong direction, I'm sorry. Okay, so just, I'll go into these in detail, but the upshot is that the key points people have made is that they remain deeply concerned about the health risks of operating. They feel like actually reopening the state and the new guidelines, there are new financial challenges that they're facing. And if you know anything about how childcare works, when you have decreased capacity and increased costs in a business or an industry with very narrow margins, the instability just is underscored. And I think many programs are wondering how long they can remain open. And what people were saying, repeatedly was with more public funding, the continued collapse of California's childcare industry seems pretty inevitable. Okay. So when we asked, one of the things we asked people in the second survey was why programs have closed. And what you'll see, and this was particularly true for family childcare, that health emerged as a primary reason why programs closed. Either because they felt the family's health was at risk, their own health was at risk, or they felt like they just couldn't do it safely. And this is where the people would respond by saying it was just nerve-wracking trying to figure out how to continue doing this work. So if we also wanted to look more closely at the financial situation that programs were facing. And of note, I think is the first point here is that 4 out of 5 open programs reported that they were open because they lacked the financial resources to survive or closure. And so you realize that these are small businesses by and large. And so for family childcare providers, their business and their home are wrapped up together. So not being able to survive, there's an issue of their own housing. And a lot of childcare centers, most childcare centers are small businesses that people have poured their life savings and work into, and that if they would open just trying to see if if they could survive. But, you know, as you can see here, programs have lost an income from families, and they have fewer, almost all the centers and most of the family childcare programs have fewer children attending than they did in January. So that the centers you see there, that they have less than, operating at less than half the number of children they had before, and family childcare just slightly over half. And so, you know, each child, the income that comes into a program is based on, you know, each family or providing, you know, resources that go to the total operation of the program. So when you cut those in half and you're still trying to maintain many of your same costs, you know, it's pretty clear to see, you know, what the consequences will be. Yeah, where's my little advanced thing? In addition, the programs have other expenses too that are higher because they're higher costs due to cleaning and sanitation, PPE supplies, and also they have higher costs related to changing their operation to meet health and safety requirements. There have been the guidelines, the regulations now for smaller groups of children, so programs have had to sort of reconfigure their space, and also because so many things are now done with sort of individual children playing with their own toys, people have had to buy different equipment and, you know, have more things that previously were shared by children, and then they have to make other changes about just how they're staffing that also affect their costs. Just giving you a second to read this slide. I think basically people don't feel like the current situation is sustainable. They were already, as one said, they were already financially stable, and now we're absolutely not stable. Our rates would have to double or triple. And if you just think back to the slide about how much parents are paying, you know, how, you know, that's just not feasible. So there's a long tradition in early childhood of the early childhood workforce basically underwriting the cost of the service because we don't have enough resources. And here what you see is that providers' financial health is increasingly dire. You know, people are going without pay for themselves, more so in family child care. They're taking on personal credit card debt to cover program expenses. And you also, some people have missed mortgage or rent payments. I think there's just a general feeling out there that the model doesn't work. And you know, there is a sense of people are just hanging by a thread. And we've started getting, you know, hearing from providers who have talked about having to close their programs, the enormous pain that causes them for something they've built for over the years, and just how anxious and worried people are. And I think the other thing that people are very much trying to be compliant with the new guidelines and regulations, but they're still feeling that often they're not clear. They can't, or they're just not doable. And I think we've we've been following them, and we've been getting a lot of questions from people. And in fact, the guidelines in California have been hard to follow and really decipher at various points. And then there's also state and local directives that are not clear, clearly distinguished from each other. And I think generally people are just very frustrated about trying to figure out what they're supposed to be doing, wanting to do the right thing, and just not feeling like they're being, either that we're being told to do something that's realistic or told clearly what is expected of them. And we also asked people about how they've been able to pay for health and safety, whether getting health and safety supplies and being able to pay for them, because that was an issue last time. And you see here that programs are still having trouble getting supplies. A good third, more than a third of programs report they are. And some programs are concerned about food. And that's just even being able to get what they need. And then looking ahead, that concern persists about whether or not they'll be able to have the funds to pay for the supplies they need or to cover their food expenses. For those of you who are familiar with early childhood, not surprisingly, there's already a teacher shortage. It's pretty much been around the entire time I've been in the field, because it's a low pay field, which is incredibly important. People want to do the work, but it's very, very hard for people to survive. And recruiting and retaining teachers has been just is just a feature of the way early childhood is financed in our state and in our country. And so now you have that exacerbated by people who are not working because of concern about health risk, either because they have some kind of condition that makes it unsafe for them, or they're judging it as not safe for themselves and their families. You have basically staff who have their own childcare issues to deal with, or schooling issues. And if people have just taken a leave for whatever reason. And you also have, almost 3/4 of programs are in a situation are not providing health benefits for all of their teaching staff, even if teachers are exposed to this risk. And you see that a lot of programs have had to reduce their staffing and then fewer paid teachers. So there's like fewer people and fewer jobs. So you would think, oh, well, maybe that's a good lineup. But if we're thinking about opening up, then having those fewer people ready to do the work. And frankly, the risks of the work are so greatly exaggerated at this moment, that's probably going to be a deterrent for people, particularly if they aren't going to be offered any kind of health coverage. So what do we do? I think that I know that there's been a great deal of effort in Sacramento and throughout the state talking about reforming our early childhood system. I guess I would say that by and large, how we've been thinking about reform have not been bold or big enough. And even the governor's proposals, I think, did not get close to dealing with some of these issues around staffing or inequity. But going forward, I mean, we now understand that schools play a childcare function, and no childcare plays an educational function, even though we don't talk about that very much. But we basically, whether you're working with a baby or you're working with a 15-year-old or an 18-year-old, you're doing some kind of care and education. And we need to somehow begin to think of those as one and the same in terms of how we resource it, how we provide for both, families, and how we also treat educators. So at the very least, I think we need to really think about aligning how we think about school and ECE in terms of safety based on community spread. And that if we think teachers working with older children need certain kinds of protections and testing and different kinds of things, and why are we not considering those things for early childhood programs as well? And those things need to be better aligned. And I also think basically, and maybe the we're hoping Congress will help with this, but there needs to be some kind of stabilization fund for all licensed EC programs to ensure their survival, and not just the programs that have always gotten public dollars, because that doesn't touch even half of the problem if we're only giving resources to programs that are already receiving those funds. And I think it's, imperative that we think about some way to provide some kind of health coverage and sick leave guarantee for early educators who are taking the risk of working with young children in this moment. So I just want to end by saying that there are about I think before there's we don't really know the exactly numbers now, but we know that there's thousands of people who do this work in our state, and we know some of them are going to work and taking an enormous risk. Others have lost their jobs, or because for the reasons we've been discussing. But you also have a lot of people who have lost their businesses and their livelihood permanently, and that we need to really consider that this is a population of people that is in California that is disproportionately Black and brown women who are living in families that are also at greater risk, have experienced higher infection and death because of COVID, and are also in communities where there's been greater, unemployment and just devastation. And that one of the things that we can do as a state is begin to think about how we address the needs of our early educator workforce, and see that as an opportunity to address some of our most egregious racial disparities. So I want to just thank the Heising Simons Foundation and the David and Lucille Packard Foundation for their support, and a call out to our workforce study team, Sean, Yunjun, and Elena, and Leah, and Ashley for the study, and also just to open it up to questions now. And you'll see on the slide that if you have questions that don't get answered, you can follow up with me, Sean, who is on the call actually, and one of the authors of the study, and also Ashley Williams, who is our senior policy analyst and who focuses on our California workforce policy.
Thank you, Dr. Whitebook, for